today?
I'm good, thank you.
Cool, now I'm just going to give you a respiratory examination today. So I'm going to have to expose your chest and have a feel around. Is that okay with you?
Yep.
Cool. Could you please take your jumper off? The first thing I'm going to do is just take your heart rate. So I've just got to have a feel of your wrist. Heart rate is about 65 and a respiration rate of about 12. Now, things I'm also looking for right now is an increased work of breathing, shortness of breath, any discoloration of the fingers, or that could indicate cyanosis. I'm also paying attention to if the patient can speak to me easily, using how many words per breath they're speaking, and if they're wheezing or coughing. I'm just going to have a look at the patient's hand. Can I just have a look at your hand? Now I'm looking at temperature, colour, and cat refill too. And if the hands were really cold and a bit bluish, that could indicate peripheral cyanosis. Now could you please turn your head to the side for me? I'm looking at the patient's jugular vein, which looks really good and normal, but if it was distended, that could indicate maybe a fluid overload or a right ventricle heart failure. I'm just going to have a little feeling of your throat, and this might be a bit uncomfortable, so just tell me if you want me to stop. Could you lay your head back a bit, please? So now I'm going to be feeling in here any tracheal deviation, which there isn't, which is good. If there was, that could indicate that there is an unequal interthoracic pressure within the chest cavity. I'm also going to be looking at the patient's crocosternal distance, which should be, that's a good 4 finger widths, which is good because it should be within 3 or 4. If it's under 3, that could indicate possible lung hyperinflation. Now I'm going to check for chest expansion in my patient. I have my hands equally on each side. I'm going to ask you to take a deep breath, please. I see my hands moved equally. I'll do it from here. Do the same, please. That's really nice and equal. If it wasn't equal, that could indicate a possible pneumothorax or pneumonia. I'm going to percuss the chest in a variety of places. And I'm going to be doing it on the exact same places on the other side. What we want to hear is just a nice resonant sound. Now I'm going to auscultate the patient's chest. So can I just ask you to take your shirt off, please?
Yeah, sure.
Where I auscultate, I'm going to be sure to do it the exact same place on the other side. Now could I get you to take nice deep breaths for me, please? Awesome. Now I'm just going to listen from your back, so if you could sit forward please. I'm just going to do the same thing. Deep breaths please. Deep breath. Sit back please. So some of the things I might have heard would be wheezes, which could indicate asthma, or else possibly some coarse crackles, which could indicate possibly pneumonia or fluid in the lungs, or fine crackles, which could indicate a pulmonary fibrosis. Now also going to do the same thing, auscultating your chest, but every time I push the stethoscope to your chest, can you please say the word hello? And here I'm assessing for volume, and if the volume is higher in any certain place, that could indicate a higher density of tissue. Hello. Hello.